See, generic formulation India has already been pioneering in all generic formulation, but in the coming time there is a lot of competition, especially on price part. And secondly, it's not vanilla generics. We have to work on value addition. So if we are able to add value, then probably we can expect some returns on that. Otherwise, if we are just talking vanilla generics, Me Too generics, then road is tough. So we have to work on differentiated program with minor modification or innovation so that patient require more than what is really required. So in that way, if we work, definitely India can again regain its position as a pharmacy of the world. So I don't see any challenge, but apart from that, some other cost competitiveness is there, where I see many Chinese counterpart or others are giving at a much better price, and we have to also work on that part. Only the scale at which we are working, we have to improve on that scale so that we are affordable, more affordable than other counterparts. And coming back to regulated markets, still we are okay. But coming back to India, where already price erosion is too much, so we have to have a scale which is sustainable and can cater more need of the patient. So digitization, anyway, it was always a part of development, generic formulation, actually even electronic lab notebook was started long back. So digitization is not something which is new to pharma field, but we have to go to next phase now, where AI can add more value. Rather than doing 10 experiments, can we just predict which experimentation need to be done? If we put the right input to AI software, then we will come up with a better option. We can do things in a fewer experiments, and we can squeeze the timeline. So there's a lot of scope on that part. I think a lot of work is going on predictability, how we can predict the stability, how we can predict the behavior of molecule on scale. So I think much more need to be done. Yes, but pharma is not behind that. At least our mid company like us, we are already working on, and a separate team to guide on AI part, and there's a lot of scope. And in coming time, it will be more useful and will help in giving affordable medicine at a better price. Because we can save on timeline, we can save on resources, we can save on chemicals. So I think a lot of benefits are there. It's only initial phase where we have to teach the software, and we are working different modeling parts. And once it is established, yes, we will be there. Injectable device delivery. Without device, you cannot deliver to the patient. So device is equally important, and we cannot just excel on one part. They say on molecule itself, we have to excel on device also, and we have to work on that innovation, and also at the scale which is like more affordable. And if we come with a device which is at $5 and somebody is giving at a $3, it will not work. We have to have innovation on device part, so that we as a whole package, when we send from India to other countries or even in India, it's not only molecule, it's also about device part. And I think the government is also doing a lot of efforts in doing that, but much more need to be done on device part. So in next decade, we don't miss on that part. So because cost is very important. And we are also coming up with the innovative idea, reusable devices. Same device can be used for 2 years, 3 years, and it will have more of positive impact on our environment. It is not only like disposable. Generally, what is the trend? You take one device, it may last for 1 day or 1 week, and then you have to throw it. And there's a time to work on a reusable device, which will work for 2 years, 3 years, and that is the next phase of work which we have to do in India. So this is very, very important. Devices, we cannot ignore it, and both innovation as well as scale and cost part we have to work. We are very well doing in the laboratory equipment. If I was just taking around in the morning, and most of the instruments are from India, and they are available, and maybe at much affordable price, but only automation part. I think where expectation of regulatory is more on automation or compliance, 27 CFR compliance. So I think that upgradation, many vendors are doing, many suppliers are doing it, and we will be becoming self-sufficient, but much more need to be done on that part. Because we are talking about AI part, digitalization part, similarly on instrumentation also, on equipments part also. This is equally important. They have to also take a same pace as drug development. But I think as a infrastructure wise, there's a lot of I have seen exhibitor, and everybody has displayed their equipments which are quite competitive as compared to other developed countries. But yes, there is still a lot of scope in doing compliance part, which will be acceptable to regulators. I mean, stringent regulators, not only India. Is it will do the work, but at the same time, compliance like 21 CFR compliance, those things has to be taken care.